Hi, my name is Dr. Jander, and I would like to talk to you about palliative care today. I work for Hospice Care and Palliative Care Services of Ithaca. I work there as a medical director, and I want to tell you more about the palliative care program that we have at Hospice Care. What is palliative care? You may have heard this term before. I want to explain to you what it means and what services we can provide for you and for your family. Palliative care is supportive care meant for anybody who has serious illness. That means anybody who has congestive heart failure, COPD, cancer, frailty, many other illnesses. A lot of people that we see have multiple illnesses that tend to happen in older people. So palliative care is not necessarily directed toward your diagnosis, it is directed toward your needs. Palliation means improvement in your symptoms, in your quality of life. How does our program work? Our palliative care nurse goes out to the house and assesses your needs. Those needs can be both related to your illness, medical needs. Do you have pain? Do you have shortness of breath? Do you need help with your medications? Do you understand what your illness is? Our nurse would help you, educate you about your illness, educate you about the symptoms, and collaborate with your physician. Your physician, whether your primary care or your specialist, is in charge of your care. Our nurse will help you coordinate the care, help to educate you, and help with symptom management. She can also help assess what are your social needs. Do you need more caregiver hours? Do you need transportation? Do you need food? Our palliative care nurse will assess your needs and help you connect it to the community resources that can be helpful. One of the biggest help that I see is assessing your caregiver burden. When people are seriously ill, it takes a toll on their families or they hired caregivers. It may be very helpful for the caregivers to have access to the nurse, to talk to them, and to try to brainstorm how to make it easier for them. Most people receive palliative care at home, about 80% of them. We also provide palliative care services in assisted livings. Nursing homes, do they provide their own palliative care service? That is their mandate. So again, what are the illnesses that we usually serve? It really could be anything that is a severe illness that needs symptom management. It could be cancer, it could be COPD, dementia, frailty. It could be advanced age when people need a lot of help with coordination of care and connection to other organizations in the community that could help them. Our palliative care program is primarily composed of the nurse who makes the house call and does the need assessment. You will have access to 24/7 on-call services. The on-call service is provided by our hospice nurses. It is a great benefit to the patients in the PASS program, which is what we call our palliative care program, PATH, that they can call 24/7. That means that they don't have to call the ambulance. There's somebody on the other line who can help them troubleshoot. There are times when you may need the ambulance, you may need the emergency room, but there are many times when the nurses can walk you through what can be done at home so that you don't have to go to the ER. Our palliative care nurse then also collaborates with your doctor and with your specialist to help with symptom management. So that's another great benefit. If needed, we can involve social work or we can involve other providers to help you to set up what is it that you need. I think it is a great benefit for you if you decide to go down this path, because you can get a lot of help that helps you stay at home, hopefully improve your quality of life, your understanding of your illness, and hopefully may decrease hospitalizations or trips to the emergency room. I want to tell you what is the difference between hospice and palliative care. Hospice is a special service for people who are at the end of life. That means that they have diagnosis that is likely to take them within the next 6 months. Palliative care is a much bigger subset of care provided to people. You don't need to have a terminal diagnosis to qualify for palliative care support. Actually, many people receive palliative care for several years before they may qualify for hospice. I think it is important to realize that palliative care helps with symptom management over a long period of time, much sooner before somebody qualifies for hospice. Obviously, we provide a lot of palliative care in hospice. We take care of the whole person. But that is only a small subset of patients that we take care of. If you need more information about palliative care program, please call Hospice Care and Palliative Care Services, 607-272-0212, or visit our website. You can ask your specialist or your primary care doctor to refer you to the PASS program. You can also self-refer. You can call the phone number and you can ask for an assessment. If you need us, we will be here for you. Thank you. Thank you for your attention.